Could malabsorption be the hidden cause of your osteoporosis? It was for me. You could be eating all the right foods, but problems absorbing it can lead to bone loss, and there is great new research showing the best ways to diagnose and fix this. My name's Dr. Tom Forfa, and I reversed my osteoporosis naturally without drugs, using my medical knowledge, and understanding malabsorption was one of those things. This channel is all for men with osteoporosis who want to reverse it naturally too. So, malabsorption happens when your small intestine can't absorb nutrients effectively from your food. This can be caused by a whole bunch of different things, including chronic diseases, infections, and certain medications. For men, malabsorption can significantly impact bone health by interfering with the absorption of crucial nutrients like calcium and vitamin D, which are essential for bone density and strength. Because when the bone can't absorb enough calcium and vitamin D from your food, it compensates by pulling it out of your bones, leading to decreased bone density and eventually osteoporosis. And vitamin D is crucial because it helps the body absorb calcium. Without enough vitamin D, calcium drops, leading to weaker bones over time. And certain surgical procedures, particularly those that involve the gastrointestinal tract, can exacerbate malabsorption issues. So for example, gastrectomies, a procedure where part of the stomach is removed, is one example of that. This surgery can reduce the body's ability to produce stomach acid and something called intrinsic factor, both of which are essential for the absorption of nutrients, including calcium and vitamin D. So a study published in the Journal of Clinical Endocrinology and Metabolism showed the link between malabsorption and bone health. The researchers there found that patients with malabsorption syndromes had significantly lower bone mineral density compared to healthy individuals. And the study also showed that men with malabsorption are at higher risk of developing osteoporosis due to lower levels of calcium and vitamin D. So, diagnosing osteoporosis caused by malabsorption involves a combination of things like your medical history, physical examination, and diagnostic tests. Here are the 3 key steps to include in this process, or to make sure that your doctor includes in this process. Firstly, blood tests. These tests check levels of things like calcium, vitamin D, magnesium, vitamin B12. Then we've got number 2, stool tests. A little bit more challenging, right, because of the nature of the test, but it's really important because they identify fat malabsorption and other signs of digestive issues. And thirdly, we've got endoscopy and biopsy. It's when they put a camera down your throat and they test for malabsorption syndromes like celiac disease by testing the lining of your intestines and stomach. So when it comes to preventing and managing osteoporosis in men with malabsorption, a comprehensive approach that addresses nutritional deficiencies, lifestyle modifications, and medical interventions might be needed. So here are 6 effective strategies. Number 1, nutritional supplementation. So supplementing with calcium, vitamin D, and magnesium can help mitigate the effects of malabsorption. So for instance, men with low levels of these nutrients might take supplements that are prescribed by your healthcare provider. Number 2, a dietary modification. So incorporating nutrient-dense foods that are easy to digest can improve your nutritional intake. So for example, men with celiac disease or a gluten intolerance like myself should follow a strict gluten-free diet to help and enhance your absorption. Also, consuming foods fortified with calcium and vitamin D, such as certain dairy products and plant-based milk, can help meet daily nutrient requirements. Number 3, regular exercise. Weight-bearing exercises and resistance training are essential for maintaining bone density and strength. Exercise not only helps in building bone mass, but also improves overall physical fitness, which can reduce the risk of falls and fractures. Number 4 are medications. In some cases, medications that increase bone density, like bisphosphonates, may be prescribed. Testosterone replacement therapy might also be required for men with low testosterone levels. This can help slow down bone loss and reduce the risk of fractures. Number 5 is regular monitoring. Regular bone density scans, as well as other ways to test bone quality, can help monitor bone health and detect osteoporosis early or identify significant changes, be they good or bad. Blood tests to check levels of calcium and vitamin D and other nutrients are also important for adjusting supplementation and treatment plans as needed, particularly things like vitamin D levels. Finally, number 6, which is addressing surgical complications. Men who have undergone surgeries like gastrectomies should work closely with their healthcare providers to manage any complications related to nutritional absorption. This might involve tailored nutritional plans, specific supplements, and regular monitoring to ensure adequate nutritional intake and bone health. Point is that malabsorption can significantly impact bone health in men. If you suspect malabsorption-related osteoporosis, consulting with a healthcare provider for appropriate treatments and interventions is essential. With proper management, the risks associated with osteoporosis can be minimized and even your bone density reversed and improved, like I did for my bone density, and improvements in your overall health and well-being as well. So for more information about men's osteoporosis, subscribe to our channel and I'll see you next time.